Hello, everybody. Welcome back. Yes, I hope I didn't lose you all and you all are waiting for me. And we can continue back the conversation. Is there anybody in here? Just let me know using the live chat. So if you're new here and you don't know what the live is about, so we're doing I've started doing lives from Sunday, and we'll be continuing till tomorrow. Unfortunately, we missed a live yesterday due to some unexpected events. So that was the only live we missed. Until then, we've done about four lives, and there's already a live that was happening from 4 to 5, and we took a few minutes of break. And the main objective of this live is to spread maximum awareness on mental illnesses. So we spoke about anxiety in the first session. So these were the things that we were talking about: different types of anxiety disorders, what are the symptoms that is seen, how do we differentiate it from the normal anxiety. We all experience at different points in our lives as part of different situations that we are exposed to, things that we see. So one common example I could relate to, the most famous and of all times, is how Monica in Friends is very obsessed, and she does the compulsive act of cleaning, and how she gently has that thought behind her back. Yes, Shweta, I'm so glad to see you back. So yeah, how Monica, constantly keeps thinking about cleaning and how her place is and the efforts she puts. Yeah, but she has a messy room, and she also has that one cupboard, right? Which is shown in one of the episodes, that I can be messy, but I just don't show it. Yeah, it's very nice to see you, Shweta. Like, I kind of really like that people are engaging, and it's not like me giving out a lecture and no one's understanding anything. So so I'm enjoying it. So post me out any reflections or things that you have on anxiety. So that's one relatable example I thought of for OCD. But other than that, most of the times it's about number of times people count, number of times people clean. Who's behind me? There is a Buddha behind me. There's no one else behind me. Okay, now the topic for hi Naveen. I'm so happy to see you back. So the next session I thought should cover on depression. What are the things that you've heard about depression, or what are the things that you know about depression? What is that common thing you've heard when people start talking about depression, or what has the media portrayed in the current times of depression? Anything that you can tell me about, or what is your viewpoint on depression, on what really do you think is depression about? If there is anything, do let me know. In my viewpoint, the common fact and the common view that depression holds is you feel sad and then you're depressed. Many people use this. Okay, so depression should be a term that should be used in a more serious way, because it really is a disorder, and it is a matter of fact of concern. And it is more than sadness that it makes it so serious, that it is a mental illness that needs adequate care. And the times that I see now, the media and everyone's talking about depression without knowing what really depression is. The fact that there's so much of information showing that it's just sadness, you feel sad, and then people are using the term depressed. I'm like, no, that is not what depression is. Depression is a more serious disorder. It is, I feel that when we start using the word so common, we're losing the meaning that um, we're losing the meaning that it should be given to people who are in that position of depression, who go through it on a very serious note, that their life revolves around it, and they experience major fallbacks and major stressors and major things coming from depression and things like that. So the WHO interestingly finds that 50% of people who are in depression don't get the treatment that they should be getting in like scientific and psychological ways, which is very interesting, right? Because depression has become, and most of us have at least heard it once in our lifetime about depression. So the awareness is there. It's not that we are not aware of the word, but we are not aware of what really is the symptom, and what really are people in depression going through, what is the underlying factors, and what are the things that people really in depression go through. So when we start using these generic terms, like I mentioned in my live on stigma and stereotypes, when we start using it so frequently without addressing the right concerns that should have been there, we're just creating a space where we demean, or we don't value the people who are really diagnosed, and they're taking treatment and things are not getting better in their lives. So that should not happen. That should not be so idealized, and we should be really careful of the words we use. So next time you feel sad, next time you're feeling a little low, use the word I'm feeling a little low instead of using the word I'm a little depressed. Okay, so getting on to the symptoms. So symptoms sometimes can be overtly seen. There's a lot of tiredness. They don't want to get up from bed. There's nobody wants to, engage, and they generally start feeling loneliness. I mean, tend to isolate themselves. They experience that social withdrawal, and it starts affecting in a way that they start experiencing changes in their appetite. So either they eat too little or too much, that they're not able to balance that moderate level. Then it is also accompanied with lot of thoughts, lot of hopelessness, worthlessness, low self-esteem, then lower levels of self concept, self image, confidence. Everything is insignificant when people go through depression. So in terms, at least if these symptoms are prevalent for 2 weeks to 6 months, is the time where we consider that, what, they need some clinical help. If it's just happening in a day, you just lost your job and you're not eating well, and maybe you're not feeling good. So there are tendencies that you might withdraw from social gatherings. There are tendencies that you might not eat well, you might not feel like getting up from bed, and things like that. So this again is a reaction or a response to that particular event. When it becomes depression is that it stays over a prolonged period. Okay, so it needs to be relevant for a longer period of time, that the person experiences such symptoms, and it should also start affecting their life. It's not like it's not sometimes it should not it's not even like it affects in one part of their lives and it's not visible on the other. So even if a person is a little facing these symptoms of depression, they might face its effects at certain specific places. Like they might see it in their behavioral aspect, they might see it in their social aspect, they might experience the physical symptoms, or they might even see it in their cognitive patterns, like what are they thinking. So they might be thinking, what, I'm so hopeless, my life is so bad, I don't have any self-esteem left. Any single thing that the person sees, also he or she can only see the other side of it. No matter what you tell them, no matter what you try to let them know of, they cannot accept it, or their state of mind is not in a way that these things get registered. So then that generally happens, and they'll start denying, no, what you can say, but my life, they generally don't even start opening up. They just be there, and then so yeah, and that's what usually seen. Is there any other symptoms that you would like to let me know that you've seen, or you've experienced, or you've seen how the media portrays, or anything about depression and anxiety? These words are so common that it's very much used. I am anxious. I am depressed. Um, Without even knowing the meaning. That's what I find is very funny. We use such. It's like we say, I'm a sugar patient without knowing what really sugar is. So yeah, kind of like that. So, okay, since no one has any reflections and I cannot see anything on the live chat, I'm just going to carry on. So, in depression itself, there are different types of depression. So, there's major depressive disorder. Then there is, okay, so what major depressive disorder is, the depression that the patients tend to experience last longer, and the symptoms definitely see the level of influence on their mood. So depression really is a mood disorder, but the major depressive disorder, it's usually it lasts longer. It sometimes lasts like 6 months, then 1 year, 2 years, 3 years. So a long duration is expected in this specific disorder. Then there's seasonal depressive disorder. So it depends on seasons. So it's usually winters that people see depression, witnessed. But it's very seasonal, like the name itself. So winters go, the depression evaporates, or extinguishes itself. So yeah, the mood and the season that you get yourself, mostly when people know that they have this kind of a tendency, what they do is they travel to different places where the levels of winter are low, or they generally start living in places where winters are not so common. Yeah, so that is seasonal. Then there is obviously when parents are new, like when you get into the each phase, like adolescence, adulthood, uh, older adulthood, every life development that we have has a impact on us. So similarly, when people become parents for the first time, or sometimes even like after pregnancy and after giving birth, there's a level of postpartum depression that is experienced. So it happens among the father and the mother, which is um, new research in the field of how even fathers are starting to get postpartum depression. So mostly the fathers experience, they don't experience the connectivity to the child, or they feel that the partner that they have is not attending to them, or they feel that the level of connection that they have with the partner has reduced, and they don't feel comfortable in that space, and the role responsibility that emerges as how they start developing as a father, or when their responsibilities and looking after the child, and there's a lot of emotional, financial responsibility that comes along. So can depression lead to? Yes. So there is research that supports that depression, anxiety, all of these can co-occur. So sometimes it's seen that someone who's going through social anxiety can also have depression. It is not necessarily always, but the chances of having comorbidities in mental illnesses like depression and social anxiety, OCD, depression, all of these are very common, and it's kind of understood that if patient shows most of the symptoms in both, then you start addressing both of them. Most of the time, like I said, in anxiety, what helps people is CBT. But to treat depression, people use different schools of thought. So there is CBT that many therapists use. There's DBT. Then there is also, but DBT is more of a personality. There are personality disorders. So most of the time, DBT, that is dialectical behavioral therapy, used to treat personality disorders. But other than that, there's obviously the Rogerian therapeutic measure, that is about a humanistic approach, like how you talk, and then help them identify the positives in their life, and how there's a lot of positive talking, and what really motivates you. So a lot of things that are individualistic, like a lot of things that promote self growth is talked about in humanistic type of therapy. Then another type of therapy that many people use to treat depression is Gestalt. So Gestalt is another therapeutic treatment that is used to see a person as a whole. So you are more than the parts of yourself, and how you as a person means a lot of things. So these kind of measures help the therapeutic process, and it facilitates the relationship, and how people really take help, professional help in depression. And then there's also another type of disorder, that is, yeah, seasonal anxiety. Yeah, okay. There's depression with psychosis. So psychosis is when uh, people who experience and who are diagnosed with depression, they start having psychotic symptoms. So psychotic symptoms is they start hallucinating, and hallucinations and delusions. So that is what psychotic symptoms are. So hallucinations are, where they start imagining things that are not happening in their reality. So this can be in different forms, voices, then seeing things that are not there, believing that there's a uh, voice that controls me. And there are actually different type of delusions. I'm not going to go in depth because that's a whole thing together. But expressing psychotic symptoms and depression, so it's usually in psychotic symptoms that people believe that they're controlled by other people. They believe that I don't have the control over my life. Someone else is controlling me. The voice is controlling me. The person, there's somebody behind me. That person is controlling me. So things like this, they believe that they lose the control of their own lives. So this becomes a very severe mental illness to live with, because obviously they cannot sit, they cannot walk, because they always believe that the voice what tells them to do things, certain things, or tells them to behave certain ways. So things like these start controlling their life. So depression with psychotic symptoms is also another common area. So psychotic symptoms in another is again like how anxiety comes along with depression as a comorbidity. Psychotic symptoms are also similar. So these are what like what are the different types of depressive disorders look like. But in symptoms, we, like I said, in anxiety also, we face, or we might have gone through these symptoms at certain points in our life. We might have started, or we've stopped eating, or we don't take care of ourselves, or all of these things might have happened to all of us at different forms in our life. But how long did it last for? And the thing that the person is diagnosable, and going to therapy is the only way out. The person cannot self help, and it starts affecting how they behave, how they interact, how they socially connected, or how all of these start interfering. That is when you realize that depression is more than sadness. It's more than that feeling of hopelessness or worthlessness that you're experiencing. It is more than what really sad is. So we all have cried and we all have vented and we all have had our share of bad days. But how long is it lasting for? The frequency of it happening, the duration that it is happening, what are the times it happens? Is it interfering in your life before anything else? Are you always crying in a period of 6 months? Have you not stopped crying in one single day? Has there not been any kind of positive or changes in your behavior? All of these kind of things help in understanding if it really is depression or if it's just a reaction or just something that everyone else is facing. So that's the first thing. Then to make another point, so there's grief. Okay, so there is a fact that we might lose someone close to death, or they might not be there in many of our lives. So we obviously will experience a share of sadness when things like that happen. So there's a level of observed grief that is okay, that you can grieve when there's a spousal loss or spousal death, or when you just lose person close to you. That level of grief is not depression. That level of grief is how individuals or human beings start grieving or feel that sadness when they lose people close to them. That is an acceptable level, which is not treated in terms of depression. It is treated as the grieving process. So there's a period of 6 months, 6 to 8 months is the observed period of grief that a person can experience the loss of a very close one. So that differentiates again from the fact that it is depression. Then another events in life, things like divorce, then losing children, then separating from family. These are all very stressful trauma, abuse, violence, going through violent behaviors in everyday lives. All of these things tend to have a psychological consequence to all of us. Whoever goes through this, to a level, all of these cause some psychological impact on our mental health, mental well-being, how we see ourselves, our perceptions. It all influences us in at one point or another. So these things are very common, and we realize that we need help when we understand the fact that what, I cannot, or this is lasting longer than I thought, and the duration and frequency is interfering on how I perceive life, how I see things. All of these, when all of these start coming together, is when you realize, okay, you really need help. You need to see a professional in health. So these are the common things that I witnessed in depression. So in depression, another thing is the idea of suicide. So there is suicide. There are people who idealize the way suicide is done. Like they only think about it. Then there is the another factor that some people are prone, and they take that behavior to do and commit it. So to understand these things, it's very necessary that we are aware of what people are going through, at least what a social circle is going through. Once the loss happens and we say things like, what, I could have been there, I they could have told me. It is very important we create that space where people talk about things to you. There's a safe environment, the community. So things like support groups are growing up very common now, that there's support groups for parents, there's support groups for teenagers, there are support groups for many new things that are coming up now. So which is a very ideal way to engage yourself, and to know that what, you're not alone in this, and there are people who go through similar situations. These might be kind of very relieving, and to share that common experience might be very valuable for many people. So again, that is also very subjective. Are there any questions, reflections, things that you'd like me to know, or you have any questions about depression? Do let me know using the live chat. Okay, could you throw some light on post traumatic stress disorder? Okay, PTSD is a specific type of disorder that happens, as the name is traumatic. It's a reflection of after experiencing a traumatic event in life. So this can be from abuse, this can be from violent exposure, this can be from bullying, all of these certain experiences that people go through. Then PTSD is also seen, how children are separated from their parents in very young adulthood, or any kind of traumatic event that is to be mentioned. One specific example I can recall is in one of my internships that I've done back in India. So I got a client who told specifically that he was working in military. Okay, so he saw a lot of deaths, and as part of their profession, they were believed to see all of this. But after years of retiring, he could not stop. He started getting dreams. He started, seeing out things, and he started hallucinating, and all of these started building up over a period of time, and that's when he came into consultation. So we realized after talking to him, and after inquiring, it was a post traumatic stress disorder that he developed from the career that he was exposed to, what kind of exposure he got in his environment and in his job. So PTSD is most often, it's not that everyone who goes through traumatic events come to PTSD, but it's mostly about flashbacks. It's about how these things don't leave and it carries forward in life. So most commonly, PTSD is seen with comorbidity of depression. So it's not that it needs to be, again, it's not like this has to happen with that, but general symptoms of sleep disturbances, flashback dreams, then how they view, how their activities also start reflecting the social withdrawal. All of these symptoms are common. So understanding the event, how the root cause, will definitely help in diagnosis. And therapy again, is mostly CBT, changing out the patterns of thought. So we cannot extinguish the reality that they had a traumatic event, or they had to go through something. It is just that we can make their lives better. It's not like going to therapy will never help you in understanding the fact that your reality can be changed. The therapist cannot help you to change your reality, but we can facilitate better. We can help and make you educate about the illness itself, and basically manage life in the situation, even with persisting symptoms, and make life better. So I hope that helps to answer the question. Is there any other thoughts, reflections on depression? If you, I can see a new hi, hello. So welcome to my life. If you're new here, and are there any okay? Are there any mental illnesses where support groups could be a better choice than personal therapy sessions? So again, I'm not going to answer it in a yes or no way, because it definitely depends on what people want to experience. So someone who's I feel that grief and things like things like grief, widowhood, things like these might feel better in support groups rather than individual therapy, because in therapy the therapist might yes, for sure, they'll empathize with you, they'll stay with you in the moment, and they'll validate your feelings and things like that. But in support groups, you'll get a shared sense of experience. You know that the other person also has gone through something like that. So I think things vary upon what the person wants to really have. So if the person is really looking forward to meet someone of how they experienced a similar situation, what did they do, or that shared sense of belief is there, then if that is what the person is looking for, then definitely support groups will be a better choice than individual therapy sessions. Because individual therapy sessions, in even in individual therapy sessions, though the person, I mean the therapist does facilitate, they cannot experience your experience, if that makes sense. So but in support groups, people do go through similar experience, though it's facilitated by a mentor and by a therapist. And there's a lot of group activities, and how the sessions are conducted. It's conducted very differently than how it happens in individual sessions. I hope that answers. Okay, so I had a very interesting question in email which said, like how we have, family doctors as physicians that we constantly give a check on. Should we have psychologists or, mental health professionals in family? So I found that question very interesting, and I did take a day or two to reflect on it. So when I was thinking, I got so many aspects to it. Okay, if there's anyone who wants to comment on it, please use the live chat. So, in my perspective, if I have a family mental health professional, the thing is, I will, or in psychology itself, it is not recommended. It is not allowed under many psychological associations that you meet people So basically, most and the accepted form is to meet people that you don't know in your as your clients, because when you treat people, the effect and the success of therapy does not get delivered appropriately, because at the end of the day, even therapists are humans, and obviously their biases come into play. And yeah, they will obviously have some prejudices, and since they might know you, things, your interactions with them, all of this will come into therapy. So that effective sense of delivering therapy gets spoiled, and that meaning of what therapy really is does not come out right. So if we have someone who is a common family therapist, it depends on how much do you, in my perspective, what it depends on is how much will you be able to share. Because if other family members also visit the same therapist, so they'll be saying about same things, but you'll be sharing about with different things. So again, for the therapist, again, it becomes very a concern of ethical issue. Like, so what if I'm a therapist and you come into my room and your mother says something else and you say something else, but what if it slips out from your mouth that what you said to your mother, right? So you might not want to reveal that information. So there's a lot of confidentiality, right? So what if things like these happen? So I'm a little worried, and if everyone in the family goes to see the same therapist, it might be a little bit issue if the family members know that we all go to the same person, so that person will be knowing everything. So the level of family rules, and how are we all going to accept that one person outside our family knows everything from everyone's perspective? So things like these, I think, will be a concern. Are there any thoughts on the same lines? Please use the live chat. These are just my perspectives on what if we have a family psychologist. Yes, there are family therapists, and they don't do it on the basics of like seeing them on a regular basis, like how we have a family doctor. but they do it in a specific duration, and family therapists are existing. So if you find people who are there in the community who are dealing with specifically family therapy, then it will be a little better, because they will obviously have more experience. But seeing a general psychologist from different fields, like a clinical psychologist who's having different specializations and experience, I don't think it will look good for the family members also. And it again depends on the culture that you're from. Okay, Naveen says, I think it will improve accessibility to therapy to more people, provided that confidentiality is not compromised. Yes, confidentiality in therapy generally is never compromised until, there is a legal issue to it. So, if the client, another thing is, if the client does not, there are three things that come there. Okay, so the first fact is, until there's a legal need that the therapist should reveal information. The second thing is that, provided that the client does not harm himself or others around them. So if these three situations don't occur, usually confidentiality does not get disturbed. But if any of this is a concern, obviously the therapist in the first session itself, these rules will be set out, and the client will also know that if these things are going to happen, the therapist will have to let out information, and things will have to be told and let out to necessary authorities. But yeah, if it's again very subjective. Like, I don't know if there's a proper answer to, should everyone in the family seek therapy with the same therapist, and should we have family therapists? Having it might, like Naveen said, on positive light, will improve accessibility, will let people know that, what, psychological mental health is important, and we all need to take care of our own selves, and it's not nothing to be ashamed of. So yes, there's positives and negatives, and again, it depends on, do you really need it, or is everyone agreeing to it? Is there acceptability of the same? So yeah, are there any thoughts, reflections? Do let me know. Okay, if there's nothing, I'm going to continue on another topic which I thought would be very relevant. That is judgment, on the topic of judgment. So, what are your views on the topic of judgment? Like, how much do you fear, or do you fear judgment? Do you think everybody judges? Do you think you are a non judgmental person? Do you think and judgment is necessary? Do you think it is bad? Are there any thoughts, reflections? Do you think we all judge at one point, or do you think we don't? Can we be non judgmental? Any reflections? Do let me know using the live chat. I'm waiting for a moment or so if someone replies. If not, I'll carry on with what I've planned. Okay, so I actually want at least a response to see if anybody thinks that they are non-judgmental. They believe that being non-judgmental is should be what we all need to have practiced, or need to have been, or should we be a little non-judgmental? Is there anything someone thinks? Okay, there's no. Okay, in my opinion, judgment is never acceptable. Everyone is different. Okay, so we'll start from there. So, what really is judgment? I think, in my perspective, judgment is very misinterpreted. Like, judgment, in basic terms, is a cognitive process that we make, like learning. We learn, we have memory, we make decision making, we have perceptual skills. Okay, Naveen says, I think I'm non judgmental to a point, but I'm certain times some amount of judgment is necessary. Yes, I'm going to start from that point. So, judgment, like any other mental process that we carry out, like decision making, learning, memory, perception, judgment is very necessary. Judgment is what will definitely lead you in life. So, to get a little more on my point of judgment, to see an object and realize that this object is this. So I have a mobile phone next to me. Okay, so this is a mobile phone. For me to realize that this is an electronic device, and under electronic device, this comes as a subtype that this is a mobile phone in particular and not a laptop. I think I need to use some level of judgment skills to understand and process information. So judgment definitely is a mental process that we all should be accepting, that we all make on a daily basis. Simple stuff like understanding that apple is a fruit and it's not a vegetable, to differentiate things, to distinguish basics. We all need this skill. When we all say I'm non-judgmental, I think it's a very wrong statement to say, because we all look at someone and make that immediate judgment that on based on their physical appearance or something, that what, this person is this. We at least make a cultural reference, right? I think we all should be open about it. And it's not a negative thing, it's all what helps us to process information. It's basic necessary skills to retain, retrieve, keep information going in our minds. Otherwise, we're going to just have a load of information. We don't know what to do with it. We're just going to have it in our hands, and there's a lot of knowledge, and we're like, I don't know what all this is. So to say that this is this and that is that, to differentiate, make knowledge in definitive terms, judgment is very necessary and is like any other cognitive skills. Now, how judgment has been portrayed is by the media. We say, what, you should not judge me for what I'm wearing, you should not judge me for what I'm saying or what I look like. So judgment has positives and negatives. It's not that all the judgments we make are positive and there's nothing negative. Obviously we make negative judgments. Where do judgments come from? Judgments come from our knowledge, our experience of particular things in our past. What do we see? What have we heard about something? That's how we see something and we make a judgment. So I should have enough knowledge that this is a mobile. I have to know what mobile does, or I have to know that it's an electronic device, and under that category it comes as a mobile phone. So this basic information processing comes from my past knowledge. What am I exposed to? So it is not that we don't make negative judgments. We do definitely as humans and as social beings, like Naveen mentioned. It is at certain points very necessary we make a judgment about something. So I judge very badly when it comes to driving. When I'm driving, I'm very bad at judging the speed of the car when I need to lane change. So that happens to me very negatively, though I am pressurized to measure that level of judgment. I don't make it accurately. So definitely I have drawbacks because of that in my driving skills. But yeah, judgment is a very necessary skill. It helps us to categorize, process information. When does it become negative is the next question. Then it becomes negative when it is the factor that we perceive information, or it is the fact when it becomes evident in our behaviors, when we start into our behavioral forms of discrimination. We start acting out on it. So to process information we need it, but when we start acting on it, when we engage in forms of discrimination, bullying, then what can I think of, violent measures. So these kind of areas also come from our judgment, right? Is there anybody who wants to comment? Do correct me if I'm wrong also, okay? So this is just my perspective on judgment. I'm not saying this is right, this is wrong, this should be the way. Okay, so in my opinion, judgment is a very necessary thing to live, definitely, to process, negotiate, command, all of that. But it becomes negative when we start behaving on it, when we start discriminating people, when we engage into things like racism, casteism, then gender issues, then things like these start happening. That is when I think the problem arises. When we start engaging into stigmas and stereotypes and believing that the judgment we make is the only way it should be, the I think what we should be focusing more on is acceptance rather than judgment, rather than saying things like we have to be non-judgmental. I think we have to be saying that we have to be more accepting of people, accepting of things that are different from our own points of view, our own experiences. All of these factors somewhere contribute to mental illnesses as well. So body image issues that lead to specific disorders like anorexia, bulimia, and yeah, that's all I can think for now. But there are many body image issues that rise from constant judgment, okay, while relating into mental illnesses. Otherwise we have issues, like we just want to conform to the norms, things like that. But anorexia and bulimia, they are specific body image issues that somewhere I think has a relation to the judgments that individuals or people face generally. So we perceive that this is the norm, this is what it should look like. We force ourselves, our bodies, to be in specific shapes and forms, because or somewhere all of this connects the dot, is what I feel. Okay, it's just in my perception, this is just food for thought. What you think should be also relevant, but this is what I think. If anyone wants to come in to let me know, is there anything you think judgment relates to mental illnesses in any way? Because I think that the fear of society, and we fear that people will judge. But the thing is, everyone judges at one point or another. We have to make that level of judgment to live as social beings. This is just in my perspective. There's no theory. There is no there's no level of scientific support or anything. It's just what I feel that judgment should look like. Is there anything anyone wants to tell? You can disagree with me on this, okay? This is just how I feel that certain mental illnesses connect to, or how mental health get also neglected in the fact and fear, and of how you don't want to be judged, you don't want to be that different person. I also had in these terms, I also had a very interesting question. What is the level of normal deviation level of deviation we can have from the normal? So it depends on so who sets these normals for us? We set as a society, or we set as a cultural part of being. We set a norm, right? Is that normal, right? I don't know how much we investigate, or how much we see and go correct our norms. A norm is set, and it is set for life. I don't know how norms get. Yes, norms do evolve, but it takes a lot of time from what initially has been set. Right. So, how much deviation is allowed? I think that should be a personal choice. How much do you want to deviate? What do you think? What do you believe is the set now? So that is a very subjective question. There's no right or wrong answers. It depends on individual experiences. It depends on what people think is right or wrong. If your rights are not my rights, I think I should be accepting. I don't know how it's a wrong, right? Maybe I might not able to comprehend your right as right, but that should not define the norm, right? I don't know. I think norms should have more flexibility. But who decides the norm, right? We decide the norm. There's a set ancestral norms. So should norms not have changes? Should we not have social relevance, or since there's a lot of evolution and a lot of technology coming in, and there's a lot of things that are different from what was back in 90s, or so if we're following norms from back in times, how can we relate it to our current times? Who decides the change? Where does the change lie? I don't know. So these questions are, I'm just posting it out as food for thought for everyone to think about, because I don't want this to be just limited to just mental illness or something like that. We should be thinking about things like this, because obviously all of this definitely has a psychological impact. It leads to psychological effects. It contributes to psychological illness. That is why social part of what people experience in different disorders cannot be neglected. A person should be considered from his biological, psychological, social factors, right? So these are just food for thought. What do you think is what I would like to know. I don't think there are right or wrong answers. It depends on your perspective, what you've been exposed to, what are your beliefs. So things like these are what I think will define how much deviation, how much do you want to deviate, what are the factors you want to deviate from the normal things. So all of this counts, I guess, in my viewpoint. Anybody has any reflections, things they would like to let me know, or anything that they want to say on judgment, on norms, um, on any reflections on anxiety, depression, anything that we've been talking about. Do let me know in live chat, or if not, you can definitely email me. My email is there on the community tab. I will also leave on the description after the videos get uploaded. I think it takes a day or two to get uploaded. So that gives a wrap to the session. So we covered on anxiety. We talked a little bit about depression. Obviously, the symptoms and things that I've mentioned here does not stop the disorder from. It's not that small, okay? So I cannot cover every aspect or everything, because that is why we have courses and things like that. So this is just the objective of these sessions, are just to draw a little bit education on mental illnesses. How often is medication necessary for curing depression and anxiety? Okay, in my viewpoint, I think we need, like I mentioned, I think in one of the live sessions as well, I think we need psychiatry and psychology to work together. So we need the biological corrections. We need to, there are neurotransmitters and hormones and level of secretions. Things like these do happen, and I think both of them working together will definitely be the curve to any mental illness and mental disorder. How often is, it depends. So if you go to a psychiatrist, they'll first recommend you a very small dose. They'll ask you what changes are happening, what is it going through. So first, they, depending on your symptoms, they'll be giving, if they first give you a high dose, then they'll obviously reduce it. Then obviously, if you've taken psychological treatment alongside, and you're seeing a psychotherapist as well, obviously you're doing the trauma part, or the root cause in psychological terms. Also, you're correcting on the other side, and you're correcting your biological correction. So obviously treatment will look effective, and obviously the recovery will look better. But many a times what people do is they'll either take only one, so which I don't feel is the correct way of doing it. I feel doing both has its own scientific basis. So it depends on what symptoms, how your symptoms are experienced. So what is the severity of the disorder that you're facing? So things like these will definitely help for the psychiatrist to diagnose, medicate you, and keep you on medication. So they'll obviously describe it to you based on your subjective experience. Okay, Naveen had told me in between. I also believe the stigma on LGBT is due to a lot of judgments. I think it's the way media, the social norms portray it. We cannot accept something that's coming out new. It's coming out differently from what the norm is, right? So heterosexual is the norm. Uh, Wait, did I go wrong? Okay, yeah. So when we just believe that there's a definite way of how certain ways, we cannot accept the new things that are coming. So obviously we are going to portray it differently. We are going to say things, we are going to portray it on media, we're going to make believe that this is wrong. So that kind of a judgment will obviously be created, and for people who cannot accept, this will happen. This will always happen. This will always happen when we are in the process of evolution and growth, is what I think in my perspective. I don't know. I think it's again subjective to people on how they see it. Is there anything else you would like to let me know? If not, we'll wrap up this session. I'll wait in for 2 minutes. But in the meanwhile, I'd like to say that tomorrow will be our last day on live, and it definitely is a very nice way to see so many. I'm feeling so good, taking these lives. I'm feeling like what, I'm doing something great, and educating a little bit in whatever ways I can. Obviously, these sessions are not meant to be the actual way, or you cannot look into these sessions and say that this is what she said, I think I'm diagnosed with this. No, this is not the recommended form of therapy, or this is not never in the objective of being the only way to take psychological help. Nothing like this. This is just for education purpose. My purpose is to create mental illness awareness, like the week suggests. So it's only for education purposes, and sharing in a bit of my experiences, my thoughts, and my perspectives on different things. And obviously it's not limited to this. There's a lot more in the field that I won't be able to cover in a week or in an hour session. So yeah, that is what it is. So in tomorrow's session, we'll be talking mostly about yeah. So someone else wanted me to talk about dual personality disorder. So I'll be covering a little bit of that. Otherwise, I'll be talking about how physical and mental health are connected. So we'll be touching a little bit on yoga, mindfulness, meditation, things like that. And in a wrap, I'll be telling y'all about gratitude, which is not connected to mental illnesses as such, but it's a topic of mental health, and I think we can all connect into gratitude and how it should be the need of the hour that we are in. So yeah, I think that covers. And since there's no reflections on the live chat, I think that will suffice. I will also put out a Google form in my community tab after tomorrow's video gets released. I just want to take a feedback on how these sessions have been for you. Any suggestions? Yes, for sure. I might have had my flaws, and I'm also doing these things differently, and it's all new for me as well. So yeah, do let me know your suggestions and feedback. That will definitely mean a lot for me, for my future lives, if hopefully. So yeah, that's about it. I hope you all have a great day, and you all enjoy the rest of the evening. Yeah, that's about it. So we'll see tomorrow at 5, and it will be an hour long session. That's it. So all right then, I'm ending the session, and we can meet tomorrow. Bye bye.